Welcome to Doctors on Call. I'm Jenna Miller. Pharmacies today are much more than just a place to dispense medication. Pharmacists provide immunizations, recommend products, in addition to providing education on nutrition, diet, and general wellness. Customer surveys rank independent pharmacies higher in personal service than those from a chain or mass merchant pharmacy. Of course, the coronavirus has spread worldwide, and although the number of cases might be lower in Kansas, what can we do to help protect ourselves? We will answer these questions and learn about operating a pharmacy and prescription drugs on Doctors on Call with pharmacist Kylee Shae and Dr. David Atkins.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from Gove County Medical Center in Quinter, healing through caring. Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A value Kansans trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
Russell Regional Hospital, experts, neighbors, friends.
Kylee Shae is originally from Plainville and received her undergraduate degree from Fort Hays State University and graduated from KU Pharmacy School in May 2019. Kylee is the owner of Paradise Roots Pharmacy, formerly Wise Drug in Hill City. Dr. David Atkins grew up in Moreland, Kansas and received his medical degree from the University of Kansas School of Medicine and completed his residency in family medicine at the University of Kansas. Dr. Atkins serves our country as a flight surgeon for the Army National Guard and joined the staff at Graham County Hospital in 2014. Our phone lines are open at 800-337-4788 toll-free if you have any questions regarding the pharmacy or prescription drugs on today's show. Doctors on Call brings you information which may be useful to you when you see your own physician or pharmacist. We'll go ahead and get started with some questions while we wait for those phone calls to come in. First of all, let's talk about how important is a pharmacy to a small rural community.
I think it is very integral, and especially in the small rural communities, because they not only provide access to medications that otherwise would only be in a chain store at least 30 minutes to an hour away, or mail order, which can't always be very reliable. And then plus they have that added benefit of helping the schools, donating to Little League uniforms, helping with scholarship funds, and then also just extracurricular activities that they can help support and help their community grow.
How important is this from a physician's standpoint?
It's unnecessary. You have to have a local pharmacy to work with your patient population. You can't say, hey, you need an anti-inflammatory or an antibiotic, or I need to change your blood pressure meds, and then rely on a mail order pharmacy to get it there next week. There's conditions that need to be treated pretty quickly, and people don't want to drive to Hayes or wait on their prescriptions to get delivered. So I think it's a must. We have to have these small town pharmacies. We have a lot of aged population in our community that doesn't like to drive, that can't drive, and oftentimes shouldn't be driving. And to keep them local is so much safer and more beneficial for the community.
Excellent. Is it mandatory that all pharmacies provide written instructions with all prescriptions?
It's not necessarily with all prescriptions. It is mandated to do it with every new prescription. So your antibiotic, your steroid that you just got, it definitely need to know that all that written information in there. And if you don't want it, we always have to offer it to you. And then with your yearly refills, like your blood pressure medicine or your diabetes medicine, it's always good to get another refresher on it. So that is kind of the mandates on it, every new prescription, and then once yearly.
Okay, what about when the doctor is writing the script? Do you actually have to physically have the piece of paper anymore, or how does that work now?
No, you do not have to have the piece of paper in your hand anymore. Actually, Steve Mayo, their pharmacist that Kylee took over from, he told me one time that it doesn't even have to be a specific form. It could be any piece of paper, and the example he gave would be a piece of toilet paper. You could write your name, date of birth, and the instructions, medication name and instructions, number of pills and the refills, and that would count for anything. We very rarely do any more paper scripts. All of our controlled substances are electronically sent over. There's a two-step verification process. It has really increased our efficiency from a pharmacy, from a prescriber standpoint. But you still have the occasion where somebody wants a prescription. I will write out a prescription, and they'll do some price shopping sometimes, or they're not sure where they're going to be. I'll give them a prescription just in case, and they'll get it filled at whatever pharmacy they happen to be near if they're traveling.
And jumping on that with like the controlled substances, Kansas has actually mandated within the next year or so that all controlled prescriptions have to come electronically. So it's just another step to help fraudulent prescriptions stay out of the population.
Excellent. Okay, let's talk about you offer home delivery prescriptions. Let's talk about that, especially right now as we're dealing with the coronavirus. How important is that?
Yes. So when we moved locations, I decided that we should expand our delivery to 30 miles. That way it covers all of Graham County and also part of Rooks County, which is also where I live. I decided to do this because my dad was diagnosed with cancer, and I was able to bring his medications straight to his house, and I saw how helpful that was, just cutting down on the trips away from home to appointments and the grocery store. So especially with the coronavirus, being able to just put it in their door and take it to Moreland or Pinocchio, or we went all the way to Lenora and Norton for some of our patients because they're like, I don't want to drive all the way to you this time. So it's really helped with our service and also just our relationship with our patients too, knowing that we care enough to go that extra mile.
Wonderful. Very good. We're going to go to the phone lines now. We've got a caller from Hayes. This is Dana on the line. Hi, Dana. Go ahead with your question for our doctor and pharmacist today.
Hi. I've been prescribed a muscle relaxant for pain, and I feel like every time I go off of it, I mean, it helps when I'm on it, but every time I go off, the pain returns. I mean, I'm afraid I'm going to be getting possibly addicted to it. I just was kind of wondering your thoughts on this.
Muscle relaxants.
It's hard to know because there's different types of muscle relaxants. And really without knowing your underlying problem, the muscle relaxant might just be covering it up, and then once you go off of it, it comes right back. So hopefully your prescriber could kind of help you navigate that to see why you need the muscle relaxant if you do want to get off of it. But usually I don't see addictive properties with muscle relaxant unless it's more in your head, but I don't think that's the case here.
There are a lot of other medications that would be worse that you'd have to take on a daily basis. Most of the typical muscle relaxers, the biggest side effect is some sedation, and after you've been taking it a while, most of those side effects go away. There's some tricky properties about muscle relaxers. They don't typically relax the muscle, but they kind of take that cramp away so you can rest or you can sleep more. I always try to find the underlying cause of why you need the muscle relaxer. Is it a disc problem? Is it a joint problem? Is it a nerve problem? And if you can find the underlying cause, there's a lot of other treatments, physical therapy, anti-inflammatories. I think it's a good idea to always try to taper down on your medications, but if it doesn't work and you need to be on a muscle relaxer, that's probably okay.
Okay, let's talk about some of those drugs that unfortunately people are abusing and how we're being proactive, how you guys as doctor and pharmacists are being proactive to stopping that.
Yeah, there's a lot of different parts helping to kind of put up walls around those addictive drugs. So like insurance will only cover 7 days, and some of them will only cover 14 days in a 60-day period. So hopefully our hope with the addictive drugs like the pain medicines, the OxyContin and those things, you only need it for an acute pain, like right after surgery or some injury. These aren't meant to be long-lasting drugs, and that's kind of the focus of the doctors when they're prescribing that now. When they first came out, we didn't know any side effects or the opioid epidemic would even be here, but now that we know, there's lots of steps that are being taken.
So we were aware of the side effects, but they promoted and said it's worth it. You need to treat pain very aggressively. They actually added pain as a fifth vital sign for a while and really recommended doctors treat pain aggressively. And that's why some of your pharmaceutical companies are getting in a lot of trouble because they hid some of that addictive data. And now we're trying to play catch up. I have a lot of older population in the community that are taking pain pills 3 to 4 times a day. And would they be better off if they were not taking them? Absolutely. Can I get them off? Oftentimes, no. They slow down on the meds, they take less, and they have withdrawal pain. They have severe arthritis pain that just comes back. So my goal in my practice is to not start any new people unless they have a very good reason to have this pain. I treat my younger population differently. You need a really good excuse to have pain meds of any kind in your 20s and 30s. 40s and 50s, to have some pain pills on hand. I mean, we've all experienced severe pain. It's nice to have that oxycodone or hydrocodone for brief periods of time. My wife just went through a pretty extensive neck surgery, and for a short period of time after surgery, she needed those pain pills. She's no longer taking any. She's doing much better, but you can't just make a blanket statement and say they're bad for everybody. Some people absolutely need them, and is it a problem? It's absolutely a problem, and we are aggressively working on it from a pharmacy standpoint, from a government standpoint, from insurance companies are cutting down on what we can do. And in our practice in Graham County, we've actually cut down our numbers quite a bit, and we're trying to keep track of it. We're taking a very proactive approach.
What are some warning signs that somebody might be like, hey, wait a minute, this isn't right? Like, I think I'm doing this too often. What are some warning signs?
I think if you feel the need, say your hydrocodone prescription for pain, you're supposed to only take it every 6 hours, and you take one and then maybe in 30 minutes you're like, I think I need another one. Kind of realizing and like self-reflecting on why you think you maybe need to self-diagnose and increase your own dose, and kind of how taking that medication makes you feel. Is it really treating the pain, or are you feeling just better within yourself for taking it? That makes sense.
So your body does build up a tolerance to these pain medications, and one of the signs that when you cut down on your dose, and anybody that has taken pain meds on a regular basis understands that you have more pain when you start cutting your dose down. And that is a combination of real pain, and it's also withdrawal pain, which I don't want to say it's not real pain, because they are experiencing severe pain when they start cutting their doses down. So it's really hard to tell when it is becoming a problem. Numerous studies have shown that long-term opioids for chronic lower back pain are not beneficial. They don't return people back to work. They don't increase their level of function, and they're just creating this addiction. And they get in this routine where they're hurting. They take a pill, they get better, so they do okay, and then they start hurting again, so they take another pill, and it makes them feel better. And then you get into a very quick addiction cycle where the only relief you have is that pain pill, and then your life revolves around those pain pills. And there's a lot of people out there. Unfortunately, we're getting really aggressive with these patients, but then there's people that absolutely need these pain pills to survive, and it's really hard on them because they're getting judged. They go to the pharmacy, they have to come to us every 3 to 4 months to get their refills. And you can't just make a blanket statement. Each patient's going to be different. You got to approach it differently. But I do agree with almost all the regulations that are coming down to screen people for depression, screen them for addiction, urine drug screens. We're doing a lot of aggressive measures to try to cut these prescriptions down. But for my practice, I'm really trying to prevent starting new ones.
Excellent. We want to remind our viewers that we are talking about pharmaceutical drugs with pharmacist Kylee Shae and Dr. David Atkins. So give us a call, 800-337-4788, if you have a question for them. Let's talk about buying prescriptions online and what's the risk of doing that?
I would absolutely not recommend it. Really, there are strict limits on the way that people can sell prescriptions online, and really the FDA and the DEA, there's like a certain emblem for certification of buying them online, but I would never recommend that. You will get drugs just as cheap from your independent pharmacy as you would Walgreens, as Walmart. Going outside of the usual chains of independent pharmacies and regular pharmacies, you're kind of taking a big risk on what you're getting. You may think you're getting one thing and it could be completely different. So for the safety of patients, I would never recommend online prescription shopping.
Let's talk about disposing of old prescriptions and if there's any truth behind that prescription drugs really don't expire.
They definitely do expire. That expiration date on the bottles is when the medicine will be up to 90% effective, and then after that year it really goes down astronomically after that. So it's really good I have to tell my mom this all the time. Even though you shouldn't have leftover antibiotics, please get rid of them because there's no use for them, and you probably need new ones anyways. But there are a lot of disposal sites that are becoming more available as we've kind of learned to kind of take steps to protect the environment. A lot of hospitals, I know Rooks County and Graham County, have a disposal site for older medications that you can just drop them off. I mean, nobody looks at them. It's very discreet, so people won't see your name and your medication if you're worried about that. And it's a lot safer than them ending up in either the septic system or the landfill.
Okay, let's talk about prescribing generic versions compared to brand medication. How do you feel about that, doctor?
I'm a big fan of generic medicines. I can treat most diseases that come into the clinic with a generic medicine. Some of the diseases, diabetes is a big one. A lot of the new diabetes meds are all brand names, so they're all going to be expensive. Some of the old metformin, glyburide, glimepiride, metformin's first line, but then second line treatment are the more expensive medicines. So sometimes you can get away with going generic if there's a generic available. I will almost always use a generic equivalent.
From a pharmacist standpoint, is one just as good as the other?
They are just as good. They have to go through rigorous testing to prove that they are just the same as the brand name medication. The only one drug class that I would say is different is the Synthroid brand name drug for your thyroid versus the levothyroxine. And that's just because the level has to be so precise to get the right treatment. So that's the only brand name drug that I would say really actually matters. A lot of the other ones, especially over the counter, if you're talking Tylenol versus acetaminophen, a generic, it's exactly the same thing, but you're paying for the Tylenol brand name whenever you do get that product.
Excellent, good to know. Let's talk about splitting pills. Is that okay? Should a patient ask their doctor if it's okay? Pharmacist? I'll start with you, Kylee.
So what I say, especially with the antibiotics, there's Augmentin, that is a huge capsule, and then there's also potassium that can also be a bigger capsule. If it has a score mark on it, you're usually okay to break it if you need to take that smaller pill in order to swallow it. A lot of the older population have trouble swallowing as they get older, so breaking those in half to just get them down is helpful. But really, you shouldn't have to split pills unless your doctor prescribes that you need to take half a dose. And most of those half a dose pills have a score mark, and if not, as long as they're not an extended release drug, you should be able to split them in half.
I have nothing to add. That's perfect.
Okay, excellent.
I have a lot of patients that'll say, "Can I cut it in half?" And I say, "Which one?" And they'll say, "That little white pill." Like, I have no idea what that little white pill is. I have no idea what they look like. I wrote the prescription. I know how to spell it sometimes, and I know the dosages. But as far as can it be cut or not, that is definitely a pharmacist question.
What kind of first aid should a person know when dealing with medications, or if they have a child that maybe ingested something, what does a parent or even an older person, what do they need to know?
With the child ingesting something, the first thing I would do is, especially if you're very worrisome, go to the ER so they can get checked out right away. If you know it was like maybe they took their ADHD medicine, they maybe got a double dose because you weren't sure if you gave it to them or if they took it. So calling like poison control, they can kind of help you take that kind of on your own. But the first aid that I definitely think people should know, like in-house, is, you know, bandages and how to treat a fever with Tylenol or ibuprofen and which one's better for you in particularly. And then seasonal allergies, of course, because that's what we see all the time, and I would glad to help anybody that comes in the door.
I would strongly suggest poison control. Even if you come to the ER, oftentimes what we're going to do first is call poison control. They have a toxicology database, and they are so much more helpful than what I have here or what I can find on my phone. They will give you exactly what labs, you tell them what was ingested, if known. Sometimes it's an unknown quantity, and they will help you work through that too. If it's an unknown quantity of this medication, they'll tell you, okay, get your EKG, get your blood work, you need to check labs every 4 hours, you need to start an IV, or they'll say that's not even close to a toxic dose, they're fine to go home with observation. And I've had patients, they will call poison control after an ingestion, and poison control will say, no need to come in. So you might actually save yourself an ER trip if you call poison control. If it's a large quantity or they're acting funny, bring them in right away. But one of the first things we always do is call poison control. As far as medications to have around the house, Tylenol is probably my favorite. Little Aleve or ibuprofen, and then allergy meds. So I agree, absolutely.
Okay. Let's talk a little bit about supplements. There's a lot of gummy versions that they've come out with now, supplements. What are your thoughts on those?
So supplements are dietary supplements. They are there to help with your diet. So like vitamin C, if you want to take a gummy or a chewable because you want to take that instead of that ugly looking orange pill, that's fine. You're still getting the same amount of dose. I don't see any problem with it, and there's no data with dietary supplements to tell you that the gummy version is better or worse than a tablet.
Okay, we have to talk about it because it's everywhere. So let's talk about a little bit about the coronavirus and where we're at, if you have any new information to share at this point.
So the latest updates for Kansas was there's 98 confirmed cases in Kansas so far. The nearest one to Graham County is going to be Mitchell County, which is actually pretty close to where we're at here. But it did not spread anymore, just we got more numbers. A concern that I have, or a caution for everybody, is we haven't been testing as many people. The KDHE lab has limited their testing to mainly epidemiologic testing, so they're trying to figure out where it's coming from, where it's going. They are testing mainly people that are currently hospitalized or the more sick, or where they can't find an alternative source of the fever. KU is working round the clock. Their ICU beds are full. They are starting to do some of their own testing. There's a lab in Kansas City, ViraCore, is doing some testing. So I think once we start testing more, we're going to have a lot more cases out there. So I would say be very cautious, but I'm also optimistic. In western Kansas, we've shut down the schools. Most of the restaurants and businesses have closed their lobbies, and there's no wrestling tournaments, there's no basketball tournaments. I think we've done a really good job of social isolation, and I think if we keep this up, yes, we're going to have some coronavirus hit us, but it doesn't have the mortality rate that some of the other diseases do. So I think we'll be okay as long as we keep up with the social isolation.
There's a little bit of confusion, I think, between what the symptoms are. Do I have a cold? Do I have a cough? Do I have the flu? Do I have the coronavirus? Let's talk about those symptoms.
Well, I think this is more your
That's fine.
I can't diagnose your coronavirus.
So the coronavirus itself has been around. This is a new or a novel coronavirus. So there's no antibodies. None of us have any natural immunity to this virus. So we are completely unprotected. If it's influenza, you have some natural immunity from previous flu shots or getting it previously. And with this new coronavirus, we don't have any immunity. So when it attacks us, we have pretty severe symptoms. We don't know the mortality rate. It hasn't been around that long. We've only known about this disease for 3 or 4 months now. So there's some estimates that it's more dangerous or a higher mortality than influenza. There's some estimates that about the same as influenza. Most of what I've seen is it's got about a 1% mortality overall, which is about 10 times greater than influenza. The symptoms can be very similar to influenza. Influenza, you get the fever, you get the cough, and a lot of sinus congestion. With coronavirus, you get the fever, you get the cough, and more shortness of breath. So when I think of influenza, I typically think of mainly right here and then just the global body aches. But with the coronavirus, it's mainly that shortness of breath. A lot of people, about 80%, get very mild coronavirus disease that don't even need to be hospitalized. So you really can't tell the difference. The biggest thing is, have you been traveling recently? Have you been exposed to somebody with coronavirus? And if you do have any symptoms at all, just stay home. And as testing becomes more common and more available, I think we'll be able to sort out some of these problems. But for now, if you have symptoms of a fever and a cough or shortness of breath, or if you've been exposed or traveling, just stay home.
And I think it's something to note is we don't know how many people have had the coronavirus. There's no way to test everybody that possibly just had the mild symptoms like he talked about. So maybe the mortality rate could be higher or lower because we just don't know whenever you're looking at the small population that has gotten tested. I do think what's kind of really cool to see, which I know it's hard to talk about something cool with something like a pandemic, but we have all these minds in science and technology that are focusing on this one problem right now. So they're talking about possibly a vaccine by the fall, and then also Donald Trump's press conference, the doctor that he had on talked about doing serology testing to look at people's antibodies that have had the coronavirus, and possibly focusing on the people that have the higher antibodies to create a drug like a monoclonal antibody, which is an injection to help treat coronavirus, which I think is so cool because it took years and years to get the smallpox vaccine out, and we're talking about months to years of possibly having a treatment for a novel virus that we have never seen before. So I just think that's cool for our time right now, and then I try to look at the positives, but besides the doom and gloom.
One of the big positives, actually, the FDA approved, I think it was Sunday, a rapid test that's going to be available. You could test somebody and have the results within 45 minutes. And the test, the machines are out there, and the test actually comes in a little cartridge. You put your sample in the cartridge and you stick in the machine. Within 45 minutes, you have a very good answer to, is this coronavirus or not? And we are in Western Kansas, so we're not going to get that test right away. But once that test becomes widely available, that's how South Korea got on top of their problem. They started testing everybody, and healthcare workers will be tested. I think once this test comes out, I think that's going to be a big game changer once we have more testing availability.
Excellent. Well, thank you so much for being our guest tonight, Dr. David Atkins and Kylee Shae from Hill City. On our next Doctors on Call, the topic will be eye health. You can email questions for our next program. The address is doctors@shptv.org. Thank you for joining us. For Doctors on Call, I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from Gove County Medical Center in Quinter, healing through caring. Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A value Kansans trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
Russell Regional Hospital, experts, neighbors, friends.